Welcome to the cardiac overview. We're going to look at several different aspects of the heart and the cardiac system as a whole. We will look at the anatomy surrounding the heart, the anatomy of the heart. We'll trace a drop of blood through the heart, and then we'll talk about veins and arteries and capillaries and how it's all connected and how it all works together. Before we really get into that, though, you do need to go ahead and grab a piece of paper, a pencil or pen, and then blue or red ink. It can be a crayon, colored pencil, whatever, but it would be beneficial for you to have blue and red because that's the colors that we'll be depicting on your drawing. So before we get started with all the anatomy and tracing the drop of blood through the heart, the physiology, we're going to draw it out in the most basic of terms, kind of what's already on the screen. So go ahead and pause the video, grab your stuff, and then once you have that stuff, you can go ahead and start back here. So we're going to start by drawing a box. So go ahead and you can draw it exactly like what I have on here, and you can leave those 4 blank spots in there, or you can just erase them as you go. Totally up to you, but this is the square that you're going to start from, so go ahead and get that done. As we're going through this, you are welcome to pause the video as you need to, or rewind it, rewatch whatever parts you need. So don't feel stressed out if things start moving a little bit quicker. Just know that you can pause it, draw what you need to, and then continue on as needed. So this is at your own pace. So after you have this box drawn, we're going to move in to, let's go ahead and just use this color, to drawing out the different sections of the heart. So I'm going to start over here on the left side of our screen, but for our purposes, and you don't have to draw this, but I'm just going to go ahead and label this for our patient sides, and I will use those to reference the different sides of the heart. That'll be less confusing as we go forward. So on the patient's right, we are going to go ahead and draw over here, and we'll go ahead and draw this square here. All right, so we've got that first one out of the way. And then let's go ahead and draw another box right here, leaving a little bit of space, and we're not going to connect to that corner. All right, and from here, we can go ahead and we're going to draw this other box. We're going to leave that gap right there and then another gap there. That leaves us with one more, and we're going to put it right in here. Actually, I don't really like that. Let me bring that back out. All right, so now we have 4 chambers for our heart. So again, remember we're using our right and our left that's based on our patient. So on the right side over here, let's go ahead and draw some pipes coming in. So we're just going to draw out to the side, just one line at a time. Anybody can draw. So I've got that one going up, that one going down, and then I'm just going to draw this other line going all the way down. And that is a representation of our vena cava. And then what we just attached it to right here is our right atrium. And then we're going to connect our right atrium and our right ventricle with a valve. And we're going to go ahead and just draw a circle right there. And this is going to represent our tricuspid valve. So we're going to draw 3 cusps in it. And the easiest way to do that is just draw a Y inside of that circle, almost like a peace sign. Now we've got our tricuspid valve there. So from here, we have now connected our vena cava to our right atrium to our tricuspid valve, to our right ventricle. So now we need to take this out of the right ventricle, and we are going to bring it over here for our purposes. So now I've got another pathway. Now this might be getting a little too monochromatic, and it may make it easier for some of y'all if you have some color in here. So if you want to put some color in here, feel free. Let's see what kind of color. We'll go with that for heart muscle. And we're just going to put a little bit of color in here, and this is just going to be representative of our heart muscle. This is not the red. This is not the intended red color. This is another color. And I'm just doing this so that it might make it a little bit easier for you to visualize as we go forward. So it doesn't have to be perfect. This is just a model, and I'm just adding a little bit right now. I'll add more later. If you do decide to color in the heart, I probably wouldn't do it just yet because there's going to be some areas that we're going to go over. We haven't connected everything just yet, but this gives you an idea of where we're at on the model. Okay, so now I'm going to draw a couple more lines. So from this box over here, we are going to draw out of the top left or the top right corner if we're talking about the patients, and we're going to bring it up and curve it over, and we're connecting it to that opening at the top, something like that, and we're just going to go ahead and carry it on out so that it can be its own thing out here. Alright, now I'm going to finish adding that heart color, which is something that you don't have to add, but I'm just putting it in here to help us see as we're drawing a little bit more what all we're dealing with. Okay. Alright, so let's go ahead and add the other entrance to the heart. So we got the entrance on the patient's right, and now we need to have an entrance to the left atria over here. And so we're just going to draw this out, and we can draw this coming around to the bottom if we want to. It really doesn't matter. With this drawing, it is not anatomically correct. It is just a representation so that we can see the blood flow through the heart a little bit easier. So when you start tracing this, it'll be way easier for you to visualize because things do cross, and the anatomy is a little bit different when you're actually looking at an anatomically correct model. So this is just to give you a representation. Down here, we're going to go ahead and just draw a couple little lungs, and they can just look like tombstones if you want them to. Doesn't really matter. And again, this is just a representation, so it doesn't have to be anything spectacular. And we're just going to say that this one connects here. And of course, these would actually infiltrate into the lungs, and it would be something really big and nice. But for our purposes, it's not going to. Alright, so let's go ahead and add the other valves that we need to. So we're going to add our next valve right here. So just draw a little circle. And this one's going to be different than the other one that we've already drawn. So that first one was a tricuspid valve. Well, this one's a bicuspid, so all we're going to do is draw a line down the middle because we're dividing it into two pieces. Alright, now we have two more valves that we're going to draw, and we'll just draw these with circles or oblong circles here. And if you want to get fancy, you can add things in, but you don't have to. They're going to be a couple different little cusps in here to give us what we need. But anyway, that doesn't really matter to this end. So now we're going to add some color to this. So we're going to start over on the patient's right side and add color in. So if you want to grab your blue, you can. The right side of the heart is going to be blue because it's deoxygenated, and we use blue to represent deoxygenation. So we're going to go ahead and color this vena cava in. And don't worry about all these terms just yet. Don't freak out. We're going to see those again when we look at the actual anatomy. So that's the vena cava we just colored in, and we're just going to bring that into this right atrium. All right, and then we can even bring it through that valve if we want to. It doesn't really matter. And then over here into the right ventricle, this lower chamber, and it's going to stay blue all the way out. So the right side of the heart is blue, and then it's going to actually come down to these lungs. So for our purposes, we're just going to write 2 lungs, and then we can come down here at the bottom with the lungs, and we'll just draw this kind of coming up like it's going to attach, and we'll draw an arrow going into it, and we'll know that that is a continuation from the top up there where it says 2 lungs. And we're going to paint this blue as well. So the whole right side is blue for our purposes. The right side of the heart is deoxygenated, and then the left side is going to be oxygenated. So when we get down here to the lungs, it's just going to be a mix of the two because we are getting rid of waste and we're picking up oxygen in the lungs, so it's just kind of a mix, and so we'll have that kind of purple color. From the lungs, we're going to leave, and we're going to have oxygenated blood. And so it's coming into the heart up here. And then we're going to go into this left atrium, fill it in, and then we're going to go through this bicuspid valve and into this left ventricle. And it is all red because it is oxygenated. It is carrying oxygen-rich blood at this point. So then we're going to come up out of the left ventricle into the aorta, and then that's going to go out to the body. So now let's go ahead and we'll just write some more on this. We can label things if you want to, and you'll see these later when we actually go through the anatomy. So we'll start over here on the patient's right, and this big tall thing is the vena cava. And then that goes into, and you can write inside of it if you want to, or you can write it off to the side. It's your drawing. You do with it whatever you want to. But this is the right atrium. Okay, and so this makes this the right ventricle, and I'm just going to abbreviate that. This makes this the left ventricle, left atria. And then let's label some more of these tubes. So the one going out of the right ventricle and up to the lungs is going to be pulmonary. Pulmonary, it refers to lungs. So if you hear pulmonary, that is a term denoting the lungs or the respiratory system. So pulmonary, and this is an artery. Even though it's blue, it is an artery. It's the pulmonary artery. And it will actually branch off and we'll have multiple. So it's pulmonary artery, or you could say arteries if you wanted to, because it does branch into different ones that gets into the lungs. So that's up to you on how you want to label that. But this is our pulmonary artery right here. And so on the other side of our lungs, let's go down here to the lungs. We'll label them real quick on the bottom down here, real low. And then leaving the lungs, the red that's exiting is going to be our pulmonary, because again, we're referring to the lungs, but this one's going back to the heart. So when it's going to the heart, it's a vein. And so that's just the pulmonary vein carrying oxygenated blood to the heart. So pulmonary vein is heading back. And then once we go into it, we have that left atrium again, the bicuspid valve, the left ventricle, and then we're going out through the aorta. So we'll label the aorta up here as well. So that's what this big structure is. And if you want to draw more arrows, you can draw an arrow right here that's going to the body. All right. And if we want to complete this circle, we can go from to the body where it's coming out of the aorta over here on this left side of our drawing, our heart. Go back over here to the right, and for the vena cava, we can draw arrows with pointing into the vena cava from the top and the bottom. And we'll just put from the body. So that's the blood coming back from the body. And then you can add arrows as we go. So with the drawing that you have, we're going to use this as we learn the blood flow, as we see what the actual heart looks like. Now that you've drawn it out and you have this visual, you can look at what the actual anatomy looks like, and then you can also look at the blood flow through it. Add your arrows as we talk about it. You will have a list towards the end of the tracing a drop of blood through the heart video. It'll pause, or you can pause the video so that you can look at those 14 steps, and you can finish putting your arrows in here. So this just is a overview of how to draw that. Now that you've got this drawn, you can go ahead and we'll move into learning the anatomy, so that you know what you're looking at, what's important, and have a good understanding of the heart and how it's going to work. All right. Let's go ahead and look at the anatomy. Let's take a look at some anatomy. So we're going to start from the skin and work our way through a couple layers, but this is going to be focused on our cardiac system. So from here, we're going to look at some placement that we talk about, some landmarks that we talk about that'll help us better understand once we get a little bit deeper. So on this model, we're going to talk about the midline, and we'll also talk about nipple line and midclavicular. So just to give you a few reference points and what that looks like. So this first line that we're going to draw is going to be the midline, and y'all may already have this figured out, but it is going to be dividing the body into left and right halves. So our midline is represented here by that solid blue line dividing the body into left and right halves. And when we're looking at a patient, remember, we're always referencing the patient's left and right. So when we're looking at this guy, his left side is here, obviously, and his right side is over here. So when we're talking about the heart a little bit later, and we get into the left and the right side of the heart, remember, we're talking about the patient's left and right, and it's like we're looking straight into their chest when we're looking at all the diagrams, everything that's represented in your textbook. We're looking at it from the anterior, and we're looking at it so that it's the patient's left and right. So here we have our midline. I'm going to change colors real quick. Let's go for a red right here. So we got our blue line, which is our midline, and then this red line is going to be our nipple line. And this is just to show you what we're talking about here. So nipple line is going to come across here. And that nipple line is going to be important to us because this is where we do our chest compressions, where that blue midline and our red nipple line intersect is where you should place your hands. There should be this should be where you put your hands to do chest compressions. So I want to take the skin off. I'm going to leave these markings on for just a second. And we're going to take the skin off and just look inside of the chest. So these lines should stay here. Now you can see where that nipple line and that midline allow us to line up and compress on the chest. So when we do our chest compressions with the heel of the hand is going to be located right there at that cross section, located on that bone in the center, the breastbone, which is the sternum. So I'm going to put the skin back on. So you see how those lines line up, our midline, which is blue again, and our red line, which is our nipple line. So that gives us our crosshairs for where we're going to do chest compressions on a patient who is in cardiac arrest when their heart stops beating. So those are the two important lines that we need to know when we're talking about the heart. And just to give you one more reference so that you've got one more invisible line to talk about. Let's go with orange here. We have midclavicular. If you hear the term midclavicular, it's going to be dividing the clavicle in half. So the clavicle attaches to that sternum or breastbone right in here, and it's going all the way over to your shoulder. So the midclavicular line is literally dividing the clavicle in half. So it comes right across here. So we're talking midclavicular. That would be a midclavicular line. And then you've also got one on the other side, right? Because you've got one on each side. And it's going to go down as well, the midclavicular line. All right. So that gives you a few of those landmarks that we're talking about. But what we really need to be focusing on is our midline and our nipple line here. So I want to go ahead and swap so that we can focus just on the chest. So let's go to the thorax here. So now we're just looking at the chest. So this is going to let us look a little bit further into this. But you still know where the nipple line and the midline are. So looking at this, I'm going to take the skin and we're going to fade the skin right here. And that allows us to kind of look through the body. So looking at this, you can still see the nipples, and you can see how the center of the chest, the breastbone, and that nipple line are still aligning. If you notice, the heart is slightly above the nipple line, or at least the majority of the heart is slightly above it. And you'll also notice that the heart is in the center of the chest with the bottom point of the heart slightly off into the patient's left. That bottom left point, let's just go ahead and we're going to take this skin off at this point. We don't need it anymore. Y'all know what we're talking about. We're going to stop this heart beating. We're talking about the apex. We're talking about the bottom of the heart. So it's this part here, which is the apex. That's the apex of the heart. So anyway, there's your reference on that, and we'll use that point as we continue on. So looking at our chest from the front, we have our patient's sternum, and we have our rib cage. Looking at the patient from the front, we have the patient's sternum highlighted here, and the sternum is attached to the rib cage. The sternum and rib cage are actually attached by cartilage. So you've probably heard that if you do good compressions, you're going to hear some cracking, or you're going to feel some cracking under your hands. This is the case for some instances. For most older adults, you are going to hear or feel this under your hands, and for most adults that are developed, you are going to feel that cracking under your hand when you first do your first few compressions. What you're actually doing is you're breaking loose the sternum from the cartilage. So again, that cartilage is just these pieces here, and that is part of our connective tissue. And looking at our ribs and our sternum here, they are connected. When we do compressions on the heart, what we're actually doing, because again, that nipple line was a little bit lower than the heart, or the big part of the heart, but it's on that lower half of the sternum. So when we're doing those compressions, what we're doing is we're actually working the sternum on a fulcrum, and we're pushing the bottom part of the sternum in so that it pushes against the heart and pushes blood out of the heart into the lungs and out to the body so that we can oxygenate new blood and so that we can push blood to the body to deliver that oxygen. So that's what a chest compression is doing. When we're doing those compressions, what we're doing is we're actually working the sternum on a fulcrum and we're pushing the bottom part of the sternum in so that it pushes against the heart and pushes blood out of the heart into the lungs and out to the body so that we can oxygenate new blood and so that we can push blood to the body to deliver that oxygen. So that's what a chest compression is doing. So when we push down, we're pushing blood out of the heart, and then we have to let the chest completely recoil, and you'll hear that when you do a CPR class. Allow for a full chest recoil. When we do that, we're allowing the heart to refill with blood. So it's really important that we come all the way back off the chest. So that gives you an idea of how chest compressions work and the importance of chest compressions. That's why the American Heart Association really puts a lot of emphasis on good chest compressions and just always staying on that chest as much as possible. So we've got a good look at how the heart sits here in the chest and what that kind of looks like. I'm going to go ahead and give you another reference point, which is the lungs. Notice how those lungs fit in there nicely. They take up a lot of space in the chest. We'll look from the inferior view here. You can kind of see how all of that fits together. And if we let that heart beat, you can see that there's room for that heart to beat and those lungs to expand as needed. So that's how everything fits in there together. Let's start taking some layers off here. Let's see some more. You'll notice that the lung, your left lung over here, when I get this pin back out, this left lung has this notch in it. This is your cardiac notch in that lung, and it's really just giving you space for that heart to fully expand. Something else to go ahead and note while we're here is the left lung has 2 lobes, while the right lung has 3. So you can see how they're divided here, and we'll look at that from all angles real quick, just to give you a little bit of pulmonary analogy or anatomy here. We've got our superior lobe on the left, and then we've got our inferior, whereas on the right we have 3 separate lobes here. And again, it's just simple naming. It's the terms that you should have already learned. You've got inferior, and then you have superior, and then the one in the middle is the middle lobe of the right lung. That's how complicated we're getting. And then on the left, of course, we just have a superior lobe and an inferior lobe. So you have 5 lobes total when it comes to your lungs. All right, so let's go ahead and hide those lungs for now, and let's look at the heart a little bit more. So there's some other structures that you're noticing right off the bat in addition to the heart. The heart is what is beating in the middle. And then we have this big red tube that's on the posterior side of the heart, the back of the heart, and it's actually arched over and coming into the top to this beating portion right here. So that middle one is arched over, and that is our aorta. The aorta arches over from the top. So this is the exit hose pipe. This is where blood comes out of the heart and goes to the body. It is the last point, or is the point of exit for the blood in the body. So it's leaving the heart and going out to the rest of the body via the aorta. So the aorta runs along your back, and it goes from your chest down to your abdomen and splits off and divides and gets into smaller and smaller arteries. So that's how blood leaves the heart. The aorta is the largest artery in your body. The way that blood comes into the heart is represented by these blue tubes. So we've got 2 blue tubes right here, and they connect to this white area, which is just showing some tissue overlay of the arteries here. and the top part is going to be the superior vena cava. So the heart actually gets fed from the top and the bottom. So if we have a superior vena cava, guess what we have on the bottom side of the heart? Yeah, we have an inferior vena cava, and it attaches right here to this. Okay, so that is where that vena cava is going to attach. So we have a superior and inferior vena cava, and they both feed into the right atrium, which is what is highlighted right now in that purple. So blood comes from the body into the heart via the vena cava. And when it comes into the body, it comes into the heart, sorry, when it comes into the heart, it is deoxygenated, meaning that it does not have a lot of oxygen in it. It needs to be reoxygenated, and we do that when we visit the lungs. So the heart is going to get it there. So the used up blood that has waste products in it and it's already given its blood to the cells out in the body is returned to the heart via this vena cava, and then it comes into the heart with the right atrium being first. And then from the right atrium, we're going to go into the other three chambers of the heart. So there's four chambers total, and the first one is going to be that right atrium. So it's what's highlighted right now on the right side of this patient's body. So the right atrium feeds blood into the right ventricle. The ventricles are the larger part of the heart. So we go from right atrium to right ventricle, and then we leave the heart, and we're going to go out of the heart from here. So we've only visited the right half, and now we're moving into the lungs. So we go from the body to the heart, and we do the right side of the heart, and then we pump it into the lungs, and then from the lungs we come back to the heart, and when we come back to the heart we come back into the left atrium, and then from the left atrium we come into the left ventricle. Now out of the two ventricles, and from this angle you can't really tell, the left ventricle is the largest. The ventricles, both of them are larger than the atria because they have the most pumping power. The left ventricle is bigger because it has to have more force than the right. The left ventricle, this one that's highlighted here, is pumping into the atria, and the atria was sending blood to where? It sends blood to the entire body. So it has to be the strongest part of the pump. Okay, so the left side of the heart, the left ventricle, is going to be our largest chamber, and it's going to have the most muscle mass to it because it's pumping further and more volume, or at least it's pumping further, not necessarily the most volume because the volume will be pretty equally spread throughout on here. And then on our right ventricle is larger than the two atria because the right ventricle is pumping blood from the heart to the lungs. So our pumping power for all that blood going through your lungs, going through the arteries and veins and the capillaries wrapped around the alveoli in your lungs, is coming from this right ventricle. So our pumping power comes from our ventricles. So what's the purpose of the atria? The atria are really just fill chambers. So their purpose is to go ahead and have preload, to go ahead and have blood sitting there ready to be pumped into or pulled into the ventricles. So they're just pre-fill chambers, essentially. That's their biggest purpose. So those pre-fill chambers, the atria, are there to go ahead and readily supply blood to the ventricles. We can have issues with preload if we have some other complications, and that's where we just don't have enough blood to go into the heart, and then we have some other issues that play out. But for now, just know that those atria are really just holding chambers. They're pre-fills. They're just ready to send that blood into the ventricles, and then the ventricles have that true pumping power. The right is pumping to the lungs. The left is pumping to the body. So that's a pretty good introduction to the heart and a pretty good overview of what that looks like. So this is what a realistic heart looks like. Of course, we've stripped away a lot of different things to get to this view, but this is the bare minimum to get you there. I hope that gives you a little insight into the heart and what it looks like and how it works and a little bit of that anatomy. We're going to now go back and we're going to look at a little bit more. All right, so now that we've had the overview of the heart and where it's located in the chest and our midline and our nipple line and our sternum and how the sternum acts like a fulcrum and how we have the cartilage and the ribs and the sternum connected, now that we've looked at that and you've also drawn out your 4-chambered model of the heart, now we're going to look at the blood flow going through the heart. So we're actually going to go through it from start to finish. Just a reminder, from this screen, you can see how that heart is already labeled and listed out for you. You've got your left atrium, which is highlighted in red on that model here, and then the right side is highlighted in blue or drawn in blue so that you can see what those are. So the left is for the oxygenated side, the right is for the deoxygenated side. That's why the colors are what they are. So let's go ahead and trace that drop of blood through the heart, through the body, and then back to the heart. So looking at this, we're looking at this heart from the right side. So it's like we're standing to the right of the patient, looking through their shoulder, looking through the side of their chest, and looking at the heart. So from here, we're going to go ahead and throw a couple other things on. And highlight a few things. So the first thing that we need to talk about in step one is going to be your vena cava, which is highlighted here and traced in blue because it's bringing deoxygenated blood into the heart. It is our first step. Some other things that you just need to be aware of on here are the aorta, which is that arch at the top, right atrium, the apex, which is that bottom point of the heart. Those are a few landmarks that we're looking at. Our vena cava can be further broken down into 2 more labels. And once you know your medical terminology, they just kind of show up and you use it and it all just makes sense. It all builds on each other. It's pretty great in that way. So once you understand your medical terminology, it just makes a lot of other things a lot easier. So our vena cava, we have the part that's coming in from the top and we have the part that's coming in from the bottom. So we have our superior and inferior vena cava. Our first stop for blood flow is going to be the vena cava. So blood is going to flow into the heart via the vena cava. It's deoxygenated, and that's step one. Step two is going to be when it travels into the right atrium. So from the vena cava, it goes into the right atrium, and that's where those squiggle lines are on here. So step one and step two, there you are. We're starting with the vena cava. We always start there for our classes. So you're going to see these white screens pop up as we go through. This is just to give you an overview of where we're looking at and then the new angle that we're looking at. So we're going to go from the right angle here. We're going to take off that anterior wall and we're going to rotate around so that we're looking at it from the front view. The anterior side of the body is what we're looking at. So let's go ahead and go to the next screen. So it's that same view. We're looking at it from the front to the anterior. We've got a few more things here. Let's go ahead and throw some more labels on. So where that blue is highlighted inside of that tricuspid valve, that is the window, that's the doorway from the right atrium coming into the right ventricle. So that's why that is blue right there. So our passageway to get from the right atrium to the right ventricle is our tricuspid valve. So we've got that tricuspid valve there. Let's go ahead and add a little bit more in here. So our first step was the vena cava. Our second step was the right atrium. Our third step is going to be the tricuspid valve. So that tricuspid valve is going to open, allow blood to flow from the atria to the ventricle so that it can be transferred and get ready for that next step. So step 3 is going to be that tricuspid valve. Step 4 is going to be our right ventricle being filled with that blood. From there, that drop of blood is going to go through that pulmonary valve, which is that little bubbly looking thing, the three lumps up there at the top. That's our pulmonary valve. It is a semilunar valve, and that's just based on the structure of the valve itself, the 3 little cusps it's got there. So that semilunar valve, that's our pulmonary valve. That's what you need to know is the pulmonary valve opens up and it's going to send blood into the pulmonary artery. And that's a close-up view of it. That's looking at it from inside of that right atria. And then we're going into that pulmonary artery. The pulmonary artery carries deoxygenated blood. It's the only artery in the body to carry deoxygenated blood. So why is it an artery? Arteries are the high pressure system of our body. Arteries also always take blood away. Arteries take blood away from the heart. So our pulmonary artery is taking deoxygenated blood away from our heart into the lungs. So our next step after the pulmonary artery is going to be taking it to the lungs. So now we're going to go from this anterior view that we were looking at, and we're going to rotate around. So we're going to look at the superior part of the heart. So we're looking down at the heart at this point. So this is the new angle that we're looking at with this image. So looking at this top view of the heart, we have our pulmonary arteries here. So that's our pulmonary artery, the main part that it just kind of outlined. And we're sending blood out through these pulmonary arteries. You notice how they're getting smaller? When we looked at the anatomical model, we had the lungs on, and the lungs would fit right over these. So these pulmonary arteries are actually infiltrating the lungs, and they're supplying the lungs with blood so that it can be oxygenated. It can get rid of waste. It's the transition center. It offloads stuff and then it picks up stuff to carry throughout the body. It's offloading carbon dioxide, carbon monoxide, other waste products that are created or found in the body, and it's picking up good stuff like oxygen to take out to the body and deliver. So the pulmonary arteries are going into the lungs, and then we have our pulmonary veins, which are represented in red here, that are bringing us oxygenated blood back to the heart. These pulmonary veins are the only veins in our body that carry oxygenated blood. So these pulmonary veins, again, we're looking at the top of the heart, are bringing oxygenated blood back to the heart. So we're going to go ahead and look at it. So this is the top view that we're looking at. This one that just popped up with the white box is our posterior view, so looking at it from behind. So you see how they all feed into, those pulmonary veins feed into the back of the heart, and that section that it's feeding into is going to be our left atrium. So let's go ahead and go through that. So from the anterior, we're going to rotate around. And we're rotating. So now we're looking at this posterior off to the left side. Now we're looking more from the back. So we're looking from the posterior. We've taken out part of the heart so that we can look into this chamber. So looking from the back of the body, looking at the heart, taking part of it off, and we've got our left atrium here. Let's just go ahead and circle that for you. The left atrium. So blood left the heart, went to the lungs, and now it's coming back to the heart via those pulmonary veins. And those pulmonary veins are bringing blood into the left atria. So that's where we're bringing blood into. All right. And then inside of the left atria, we have this bicuspid valve, which you can see a little bit better in this white picture down here. And it's a bicuspid valve because it only has two cusps. So we had our tricuspid valve that we had earlier that had three cusps, and it literally gets the tri from three, and then this one gets the bi because it has two. So our bicuspid valve is going from the left atria to the left ventricle. Now you might be thinking, oh man, I'm never going to remember the left versus the right and which one's going where, but it's actually really simple. You ride a tricycle before you ride a bicycle, right? So tri and then bi. And then for some of you, it may be easier to think, well, you try something before you buy it. So if that works, use that as a memory aid. But the tricuspid valve comes before the bicuspid valve when we're talking about blood flow. So the tri is on the right and the bi is on the left. So this bicuspid valve is going to be what we go through from the left atrium going into that left ventricle. So let's go ahead and come around a little bit more. Also, before we move on, the bicuspid valve is also known as the mitral valve. So you'll hear that term as well. All right, so we're looking at the heart from the anterior side, the front side again, and we've removed a section so that we can look into that left ventricle. So you've got your apex down there at the bottom, you've got your aorta, we've been using that kind of as a landmark. We've got our bicuspid valve here, circled. We've got our left ventricle, which is where that blood is flowing to. And now you've noticed that we've changed our color to red, and that's because red represents oxygenated blood. Okay, so the left side of the heart deals with oxygenated blood, while the right side of the heart is dealing with deoxygenated blood. So our next step is going into the left ventricle, and then we have to leave the left ventricle. And remember, the left ventricle was the largest chamber in the heart, the most muscular, because it has to have the most pumping force, because it's pushing blood out to the entire body from here. It's going to do that after it goes through a valve and goes out the aorta. So let's come around a little bit more. We're going to swing up so that you can see that. So we're looking into the left ventricle, coming up. We've got another lunar valve here. And so now this is the angle that we're looking at. So this valve is our aortic valve because it leads into the aorta. So it only makes sense that it would be the aortic valve. So that aortic valve is what the blood is going to leave through, and it's going to the aorta. So let's go ahead and highlight that. So now we're leaving the heart and going out to the body via the aorta. So our blood flow through the heart. This is just our summary. Is our first step is the vena cava, then the right atrium, tricuspid valve to the right ventricle, then we're going through the pulmonary valve, the pulmonary artery, the lungs. From the lungs, we come back via the pulmonary vein, which is the only vein that carries oxygenated blood, and then we're going to the left atrium, and then we're going through the bicuspid valve, and through that bicuspid valve, we're going into the left ventricle, and from the left ventricle, we're going through the aortic valve, and then from the aortic valve, we're going out the aorta. From the aorta, we're going to the body. You want to give you just a second if you need to pause and write this down, or if you want to screenshot it, now's your chance. But those are the 14 steps of getting blood through the body. Through the heart. So those are our key points for blood flow through the heart. So let's look at the actual key points that we have here. So tricuspid before bicuspid. Just remember, you try before you buy, or you ride a tricycle before you ride your bicycle. Hopefully that memory aid will help you as we're talking about our different valves in the heart. Another thing that you need to remember is that the right side of the heart is deoxygenated and the left is oxygenated. So the right is deoxygenated, the left has oxygen because we've already been to the lungs. You got to go to the lungs so that you can get to the left and so that you can have oxygen. So just remember, the left side is loaded with oxygen, the right is lacking oxygen. So veins and arteries. Arteries always, always, always go away from the heart, and veins are always going to the heart. So that brings us, back over here to where we started. So now you can use your arrows if you want to. Rewatch this video, draw that blood flow through the heart. You've got your 14 steps to get it through there. You've looked at the anatomy, you've drawn your model, you've traced it. Now you just need to remember it. It may be worth you just going over it over and over in your head. A great way to do this is to find your study partner, whoever that is, and y'all just go back and forth and trace that drop of blood through the heart in your heads. So one of you start off and say, all right, we start with the vena cava, and then it goes into, and then your partner answers the next step, and then you answer the next step, and just go all the way through to the 14. But that is the blood flow through the heart. Really important for you to understand that, because there's a lot of different diseases and disease processes and cardiac event and pulmonary events that are related to how this works. So this is a really important basic step. Now, we are also going to look at one more thing. After the blood leaves the heart and it goes out the aorta, what does that look like and what are those next steps? And so we're going to look at some arteries and veins outside in the body, outside the heart in the body, and how they function. So we're going to look at those next, but those 14 steps are going to be pretty key. So let's go ahead and look at that next part. Let's look at what happens to the blood flow after it leaves the heart and it's leaving out the aorta. So starting with the aorta, we're going to keep getting smaller until we get as small as we can, where we exchange those necessary components, where we're giving oxygen away, picking up waste, and bringing it back so it can be expelled. So we go from large down to our tiniest, our smallest, and then we're going to get bigger again. So from the aorta, it's our largest artery. It's going to be taking oxygenated blood away from the heart. So the oxygenated blood is being taken away via the aorta. It's going to branch off into smaller arteries throughout our entire body. Those arteries are going to get even smaller, and those are called arterioles. And then the arterioles are going to get to our smallest blood vessel. Our smallest blood vessel is going to be the capillaries. So the capillaries are where the oxygen is going to be exchanged. So looking at our models here, the one on the left, this one here, that's now the only one on the screen, is our artery. It's our representation of the artery. So when we're looking at it, it's a little thick when it comes to the muscle. It's a little bit thicker than its counterpart over here, which is the vein, which is kind of thin. So let's bring those back around here. So we're going from artery on our left, which is the thicker one, going through the middle, which this middle part is our capillaries, and this small little network is where those cells in our blood are red blood cells, white blood cells, where all of those are flowing through, and this is where they slow down. And this network is so finite that it actually, in places, we have these cells lining up single file so that it can exchange oxygen and nutrients and pick up waste. So we get really small, we increase our surface area, the amount of area touching each other, so that we can give away the good stuff to the cells in the area, and because we have these throughout our body, and we can pick up the waste and take that back so that we can get rid of it. So that is what a capillary is, and that's why it is where it is. So we go from our aorta to our arteries to our arterioles to the capillaries, and then from the capillaries we're going to start getting bigger, and we're going back to the heart. So now we're taking the deoxygenated blood, we picked up some waste, and we're going to go from the venules to the veins, and then from the veins you're going to go to our largest vein, which is our vena cava. So that's that blood flow from the body. So remember, when we started our blood flow with the heart, we started with the vena cava and we ended with the aorta. And here we're starting with the aorta because that's where we left off. We're going throughout the body and then we're coming back to the vena cava. So we've created a loop at this point. Okay? So here we've completed that. Now let's look at the anatomy of these just a little bit closer. So we're going to start with our artery. We noticed that it was a little bit thicker, and this middle layer is what makes it thicker, and that is smooth muscle that is wrapping around this artery, because our arteries are our high pressure system. Remember, the aorta is pumping blood, or the left ventricle is pumping blood through the entire body via the aorta, through the arteries, all the way down to the capillary. So our driving force is going to be on our high pressure system, which is the arteries. So we've got this smooth muscle that wraps around those arteries. So this helps push that blood along, and it helps squeeze as necessary and adjust so that it can adjust the size and adjust the pressure. So that's why that's a little bit larger than we see over here on our vein. So when we're looking at our vein, it's not nearly as big. We've got elastic fibers here, and we've got our smooth muscle. and it's just not nearly as big as our artery over here. So it doesn't have to be as big, it doesn't have to be as strong because it's our low pressure side. Once we go through these capillaries, it's slowing everything down, and now we're getting to the low pressure. We've gone from our high pressure arteries through the capillaries, it's pushed through there, it's given away what it needs to, it's picked up what it needs to, and now we're in our low pressure venous system. We're on the other side at this point. Now, if you notice in this little model that we've got here, this artery has nothing in it. It's just open, it's just surrounded by that thick, smooth muscle. But when we look at our vein over here, it has a structure inside of it. And this structure that's inside is actually a valve. And we looked at some valves in the heart. This is kind of the same principle. Why do we have valves in our veins but not in our arteries? Why is that? And the reason behind that is because these valves keep blood from flowing backwards. So it keeps everything flowing in one direction. And that's the importance of those valves. So that's just a quick overview of our arterial system and our venous system and the blood vessels as a whole. So that's what that looks like. And I hope that gave you a little bit more insight into what is what. So now that you've had a good rounded out experience with this, that is a good overview of our cardiac system.